Egg production can put chickens at increased risk of reproductive disease because essentially they're using those systems all the time. And the breeds that most people are obtaining for backyard pets and to produce eggs for the family are breeds that have been developed for egg production, and so they can be very prolific egg producers and churn out eggs. And basically, over time, the ovary or the oviduct, which is their uterus that produces the egg, can become diseased and dysfunctional in multiple different ways. Some of the most prevalent things that we see are cancer of the ovary and of the oviduct, which very frequently metastasizes or spreads locally to the adjacent GI tract and intestine. So they can present in many different ways, which presents a little bit of a challenge for us practitioners that see these birds. So cancer is probably one of the most common things that we see, but we also see infection of the oviduct, as well as trouble having eggs passing, so egg binding or dystocia. Sometimes there'll even be ruptures of the oviduct and an egg or egg material leaks out free into the body cavity and causes peritonitis. So that's another angle. Also, we oftentimes see what's called oviductal impactions, which means that the oviduct can become basically filled with many layers of accumulated albumin and yolk, and creates these sometimes very large, like maybe even the size of a cantaloupe, foreign bodies, if you will, inside the oviduct that are kind of like a pearl, where the center of it may have begun with a single yolk, and then layers of egg material have been added to the outside until it produces this huge objects that takes up space within the body cavity. And those are most always surgical cases.